I think the most important thing is that Americans, everybody in the world, really wants their government to give them guidance on this thing, because half of this is science and half of it is psychology and behavior and whether you can trust that your government is in charge of stuff. We got two problems on that front. One is we have lots of reasons not to trust Donald Trump. Think Sharpiegate or the 15,000 lies that he's told. And we have real reasons to wonder whether Mike Pence is the guy who should be in charge of this, given that he has spoken and written about needle exchanges not preventing infections and smoking not killing you.
Yeah, I mean, Ali, I wish I could come up with a line better than your point, that it's a crisis of both confidence and competence. On the confidence side, anyone at this point in time who believes what Donald Trump says kind of gets what they deserve at this stage in the game. But the problem is that the administration has silenced the people we can trust. Dr. Tony Fauci, the world's leading infectious disease doctor who served 7 presidents, Democratic and Republican, has been gagged by this administration. We're used to seeing him out front in this kind of situation. He's been told he can't go on TV unless Mike Pence approves it. Same thing for other leaders at CDC. So we can't trust our president, and the people we can trust aren't being allowed to tell us the truth. And then on competence, you talked about this testing problem. We have had 2 months' notice that we would face this moment. Why didn't the administration accelerate the production of test kits? Why didn't it distribute them more quickly? Why wasn't the president's task force focused on this as task number 1? So I think we have both problems in terms of how we communicate and what's being done.
Lori, let's listen to what Health and Human Services Secretary Azar said a little while ago about these test kits.
Will very soon, through the FDA, be rolling out streamlined guidance that will allow private labs to be able to create their own tests based on essentially the recipe that the CDC has used in their test kit.
Give us some context here. What's he talking about?
Well, the problem is we don't have a standard, and we would like to have everybody getting tested by the exact same standards so that we can compare and we know and we think we have accurate information. At the moment, only about 450 people have been tested nationwide at all. Today, the mayor of New York held a press conference to denounce federal policy, saying we have the competence in the city of New York and in our health department to execute testing ourselves. Why do we have to wait a week to get answers?
Right. The case number 2, I believe, or case number 1 in California, Northern California, that was one of the problems, that they had to get clearance from the CDC to undertake certain testing.
Well, and it's worse than just, do you manage to quickly test the identified suspected case? What we should be doing right now is using the test to do some serious surveillance to figure out, are we really missing a lot of cases? If I were able to wave a magic wand, I would say, let's go into every single pneumonia intensive care unit around the country and test and make sure the cause of their pneumonia is not this coronavirus.